Good morning. Mr. Hutchings, we have minutes and claims.
Yeah, minutes from January 7th. Those.
Reviewed minutes, and I would make a motion to accept.
I will second that motion.
All in favor?
Aye.
All right.
Then we have claim docket for December 31st of 24 through January 3rd of 25 in the amount of $557,000, $622.09.
Reviewed, and I would make a motion to accept.
I'll second.
All in favor?
Aye.
Thank you. Aye. Next on the agenda is awarding property demolition bids. This will be for a total of $93,673. That includes $28,000 in landfill fees, $65,673 in bids to 3 different companies, actually maybe 4. The first is at 5083 North Lafayette Avenue for $6,123 to McGuire Excavating. Second is 5351 South Jeff for $4,500 to JCB Excavating. 148 East Holt Drive for $4,500 to JCB Excavating. 8686 North Baldwin for $6,500 to JCB Excavating. 8989 North Baldwin Street for $6,000 to JCB Excavating. 7628 East Devonald Avenue for $4,500 to JCB Excavating. 7672 East Devonald Avenue for $5,800 to JCB Excavating. 2255 North Orchard Place for $3,550 to Bell and Bell Construction and Excavating. 2351 Oak Cliff Road for $2,500 by JCB Excavating. 3075 East Cottam Drive for $6,900 by S&G Excavating. 7185 Eliana Road for $4,000 by JCB Excavating. 264 South Hobson Place, $6,000 by JCB Excavating. And last at 190 South Hobson Place, $1,800 by JCB Excavating.
Mr. President, I'd like to move to accept these as and move ahead with the demolition properties.
All in favor?
Aye.
Aye. Next up would be Norm Froderman. Would you like to come up and...
How about Norm Loudermilk?
Norm Froderman. Oh, that's not Norm Froderman. Yeah,
Better.
sorry. Norm Loudermilk. Thanks, Norm.
Yep. So I just want to give everybody kind of an update on the situation with the group homes. Since we've brought our team in there and started looking at some things, we've obviously obtained state licensing, and so we're good to go with the state. We've met with the Division or Department of Child Services like on 3 different occasions to make sure that we have all the compliance requirements in place, and we're moving forward with some of our deficiencies right now. Just to be very frank with you, and that's what some of this agenda items are, is there's just no capital to spend at the group homes. There's nothing in the budget that would allow for some of the structural improvements to occur that need to occur, as well as some of the supplies. So after consideration, we thought we would try to ask the commissioners to amend an ordinance that was established in 2020. That ordinance established a non-reverting fund for the Vigo County Juvenile Justice Center, where we captured out-of-county fees for detainees that we hold from out of county, and that we would be able to use that for projects at the Juvenile Justice Center. By amending this ordinance, it allows us to use some of that revenue for the group homes as well. Until we can develop other revenue streams, we would like to do that just as quickly as we can. Things that we need right away are things like we need a dishwasher when we have leaks. Of the 4 restrooms we have, 3 of the appliances leak. We have an apartment-sized refrigerator, obviously with 8 children living there, and we need a bigger refrigerator. There's no microwave. We don't have any couches. The bunk beds are broken. And I say the bunk beds, it means all of them. So we just need to, this is quite frankly, a starting over process. And we're going to be successful. We're going to thrive, but these are some things we need to get done. My target open date is Valentine's Day. So we're going to get all this stuff in place before the end of the month, and then make sure, we don't even have any plates, so we want to make sure we get some of those types of things. I brought a contractor over to look at some minor repairs and some things we need to fix. Our fire alarm system is currently not being monitored, and we want to make sure that those things are fixed and in place before we obviously bring some kids in. So with this change of the ordinance that I'm requesting, it'll free up some revenue. We have an approved budget for about $288,000 for the juvenile center out of this non-reverting fund, and there's still over $300,000 in that fund, and we get money every day. And so we can free some of that money up to spend at the group home, and then the next item on the agenda, which I'll speak about in just a minute, but so I guess that's kind of where we are now. Administratively, we're reducing some positions, combining some positions. So I think in the long run, we're going to save the county money. And so that's as well as being able to accept kids. And just as a side note, in the first 24 hours that DCS found out that we were staying open, I received 24 requests to put kids in our home. So it isn't like that the need isn't there or that they don't want to put people here. It's just that we simply weren't. And so once we get these improvements taken care of, we'll start accepting kids. So on the ordinance for an amendment, I'm happy to answer any questions.
Any questions on
No, I want to talk to you about the non-reverting fund here. I got difference of amounts, what you stated and what I checked on. I'll check with you on that.
We had a great conversation with Norm yesterday for about 2 hours and discussed several things. And then your non-reverting, Norm, you still have to go to the council and get an appropriation, correct?
Yeah, so anything that the commissioners write as far as an ordinance that deals with finances, I still have to go to the county council for either an appropriation of that money to do a project or for a budget, which is just an appropriation anyway. So yes, this is not just money that we're able to just spend, anytime we feel like it. We have to have a plan, get quotes, go to the council, present them with the plan, and then ask for their approval. The good thing about this is it's a user fee, so it's not tax dollars. So we're able to leverage either out of county detainee money to help pay to upgrade the group home, or in the second ordinance, leverage state money from DCS to help upgrade the group home. Either way, it has to be approved by the council.
I reviewed it, I'm okay with it from a legal perspective.
Yeah, I'll, made enough to admit that as an elected official, I think I really dropped the ball on group homes over the last 4 years, being a county commissioner. One home is completely dilapidated and lost its license. The other home hasn't seen children for probably 2 years now, and it's atrocious the way that group homes the way it turned into. It's actually really emotional because there's so many kids sleeping in DCS offices, and we could have certainly done a hell of a lot better than what we did over the last 4 or 5 or 10 years, even before COVID. The old group that had group homes made it so difficult to get a child placed there that they only could keep 2 or 3 kids at a time. And it's ridiculous the way it was. And I think that's one of the reasons we're glad Norm stepped up. He deals with a group of children that suffer from trauma and distress at home, and that's exactly what these kids need, is a place to live for emergency placement when their parents are going through something. And we're glad to get this going. It's not going to be easy. Norm's got a large task. We got to relicense one house. It's going to be a monumental task. The house on Rose Hill has a lot of moisture issues and needs some remodeling. So this fund will allow Norm to go to the council in February, seek some funds to make some much needed repairs to get at least 8 children back in the Glenn home, which is what we're looking for. So if there's no other questions, I'll make a motion to approve ordinance 2025-1.
Yeah, I'll second that. This is a monumental task we're taking on here, really. Like I say, Commissioner Schweitzer said, overhaul, much needed service. We've got some revenue. We're going to attack it.
Okay, all those in favor?
Aye.
Aye.
Number 2.
Thank
Next-
you.
Next up would be the ordinance 2025-2. You'd like to speak on that also?
Yep, so, again, Mr. President, members of the Board of Commissioners, Norm Latimer, the Director of the group homes, I guess. So this ordinance is the exact same as the ordinance that was passed in 2020 by the Commissioners. It establishes a non-reverting fund for the group home. That fund will capture revenue that will be used to provide training, continuing education, training for staff members, and keeping in accordance with the guidelines set forth by the Indiana Department of Child Services and other agencies with oversight with the Vigo County Group Home to provide for maintenance, repair, purchasing of supplies and/or necessary equipment, safety, security, and general operation of the Vigo County Group Homes. So this can't be used for salaries, can't be used for overtime, can't be used for pay of any kind. It can only be used for things that are there, infrastructure improvements, and also training. The staff is required to have a certain amount of hours training in accordance with Department of Corrections, or strike that, in accordance with the Department of Child Services. And so because of that annual required training, there's a cost with that. And so what this does is it allows us to capture a portion of the revenue that is brought in annually to the county. So let's talk figures. Right now, the fee that the DCS will allow us to charge for one child is $1,100 a day. If you multiply that times 8 kids, times 365 days, that's $3.2 million a year. The budget for the group home is 1.4. So you see there's more than enough to bring money back to the county to offset the entire budget, salaries and operational costs for the entire group home. Now, let's pretend we don't get 8 kids, which is completely crap because I know we're going to get them. But let's say we only get 5. Well, if we get 5 kids at $1,100 a day, leaves $2 million a year. And again, the budget being 1.4, that still leaves, more than $500,000 that could be put to the group home that we would be able to spend. We have 4 vehicles and 2 of them don't run. They haven't ran for a year and nobody knows why. Today I was called this morning to let me know that the furnace in the group home doesn't work. It's 60 degrees in there right now. I asked what vendor they used. They said they had no idea. So I'm scrambling, trying to get a hold of Ricky to find a furnace guy to get over there. These small types of things, I don't know what I'm going to walk into, a brand new furnace, or we just need to repair it. I don't know what's going to go on. So what we've asked for in the ordinance that was passed in 2020 for the juvenile center, it was all that we got, we capture. Because the county didn't recoup any money then. Well, the county recoups a lot of money. So we would just like to share that, to split that. So in this ordinance, the request is a 75-25 split. So 3/4 of the money that we bring in annually would go to the county to offset the costs of all of the work. And then 25% would stay in a non-reverting fund Of course, we would get permission from the commissioners to spend it, and then go get approval from the council to spend it. And then we would do the projects, whatever it may be. A new furnace, a new roof, buying vehicles, whatever it is. The good thing about this is, once again, we're leveraging state DCS money to do local projects. And that's what the beauty of it is we're able to save that stuff. The only debate is how much we're gonna need. And here's the other beauty, this isn't a 10 commandment. So if you wanna leave it like this for a couple of years until we get some revenue built up and take care of some projects, and then change it to 100% going to the general fund, that's fine. Because we've taken care of the many things that we need. But I think if your goal is to get this 1306, the Glen Home, they call it, reopened and thriving, and then later on this year, move to the Carpenter Home, which is on Rose Hill, and then begin refurbishing that and get that open, we're gonna need this money for a couple of years. And then if you want to relicense the one on 64 Gilbert, well then, that's a bridge we'll cross then, but at least we know we'll have the money to do it. You won't feel guilty about going back to the council asking for money from the tax base or hurting the general fund. You'll know that we will be able to pay for it out of this. So this is nothing different than what we're doing, have done since 2020 at the Juvenile Center, which is supplementing our budget with state revenue. So I'll be happy to answer any questions you have.
I agree with this also.
I just want to thank you, Norm. This is a big undertaking you're doing here. You know, without you stepping forward, the group homes would be no more, and we know how many kids need this service. Your attention to detail at the Juvenile Center, I know you're going to make this work. Just wanted to thank you, and
That's great.
yeah.
We've basically given Norm a year to see if it can be successful, and Norm's taken on a pretty big task. And then also yesterday, we talked about restructuring some of his employees and the employees at the group homes to where they can make a little bit more money, but will be offset by the cost of having the kids in the houses. So it will not be any additional cost to the tax base or the general fund. We talked about different numbers of 75-25% or 80-20. Ultimately, we landed on the 75-25, and that's what has led us here today. So I'll make a motion to approve ordinance 2025-2.
Second.
All in favor?
Aye.
Aye.
Thank you. I just want to let you know that with the support of the commissioners and other elected officials in the community, there's no question we'll make this work.
Mr.
Thank you.
Loudermilk, if you want to appear by Zoom in the future, we know at your age it's difficult for you to get up and get going, especially getting right
Just-
from the nursing home.
We'll get a stool
so
to sit on or something.
in the
Thank you.
future, you can let us know.
Thank you. Okay, next up, we have some folks here from Hamilton Center to give us annual update.
Good morning.
Good morning.
Thank you for having Hamilton Center here today to give the annual update. I'm Emily Owens, Chief of our Clinical Outreach. Been with Hamilton Center over 20 years now. In your report, we did mail the report as we do every year, but I did hand you a copy this morning. You'll find the time frame for this report is July 1st, 2023 through June 30th of 24. The first page there, you'll see the board members from Vigo County. We have Larry Cheeks, Andre Kumaro, Paul Lockhart, Norman Lowry, Bobby Moore, Michael Nasser, Anthony Tanous, Michael Tom, and Jim Winning. Moving on, in the report on page 1, you'll see our patients served throughout the year. We served 4,216 patients. Adults, we served 2,990, and youth, we served 1,226. We did provide a little over 19,000 clinical encounters So that means our outpatient services, therapy, things of that nature. The average time from the initial appointment to the time someone inquires about that is approximately 17 days, so about 2 weeks. But we also have a walk-in option as well, where anybody can walk in to any of our sites at any given time to be seen for an assessment. Moving on to page 2, you'll see the sources of payers that we deal with. Of course, the biggest payer that we get reimbursed is through our Medicaid population. The second is then the third party commercial insurance payer, and then the third is our self-pay. Just some highlights of our community outreach throughout the year. We are involved in numerous community outreach activities, as you all are aware, but just to highlight, we are a member of the United Way of the Wabash Valley Impact Council, Vigo County Homeless Coalition, the local coordinating councils, the Community Resource Alliance. We attend these commissioner meetings frequently, monthly at least, just to get updates and to answer any questions that you all have. And then, of course, the school corporation, we are on a school safety commission. So those are just to name a few of our outreach efforts. We also, as a community mental health center, want to ensure that we're out there in the community providing information and education to those that might need our services. So we are involved in numerous health fairs, community health fairs, the Wabash Valley Connect Fair, National Nights Out, Union Hospital Diversity Fair, Housing Authority fairs, the Homeless Awareness Day, et cetera. You'll see that list as well. Some new programs that we would like to highlight to you all for this past year. We did reestablish a partnership with vocational rehabilitation to be able to take those referrals from VR to help with supported employment for those individuals that are interested in getting back into the workforce, to provide support on the job coaching, working on resume building, and finding jobs for those that are interested if they meet that VR criteria. We also established a partnership with Union Hospital to provide a peer support provider to assist transitioning patients out of the ER to make sure they have the services that they need at point of discharge. We've built new partnerships with the Eastside Christian Academy to begin taking those referrals for those students that might need an extra support for therapy. And then last year, I did talk a little bit about the mobile crisis unit that we had started. We have expanded on those efforts as well, where we are able to go out into the community based on any needs that anybody has, to assess individuals where they are if they might be in a crisis situation, a mental health or substance crisis situation. We work very closely with law enforcement on that as well. Moving on to our addiction services, we provided 1,683 services to adults, and then we had 13 youth that had addictions concerns. We also, our locations, we are behind the courthouse, as most of you know, for our outpatient services, and we also have an opiate treatment program, the Western Indiana Recovery Services, right next to that building. Grace Clinic is our federally qualified health center at our main center, where we are able to provide addictions treatment as well. And then we also have a 8-bed transitional living unit on Oak Street, where it's a 90-day program where adults can come, male, if they need that more support for a 90-day step down to get back out on their feet, to try to help stabilization, and to get intensive services for that 90 days to then eventually be on their own. You'll see the listed evidence-based practices that we use. Won't name them all, but Matrix is one of those, Seeking Safety. I do want to also mention, I think we talked about this last time, we have providers that are trained in gambling treatment. So, you know, with the casino here in town now, if there's ever a need for any individuals to get treatment with gambling, we have providers that have been specifically trained through the state in that type of treatment. Moving on to page 5, you'll see the common addictions that we typically see from those that we serve. Stimulant use is our highest diagnosis, next to cannabis and then alcohol. Those are the top 3 for adults. And then for youth, it's cannabis, alcohol, and then tobacco. The mental health services that we've provided, adults, it has been 1,787 adults have received those services, and our youth, it's been 1,301. Again, the main locations that we serve is, of course, our office, but then we also have a partnership with the Vigo County School Corporation. We're in every single school in this county, whether it be a therapist, a care manager, to make sure that we are there whenever these kids need our support. Even if it's just a short-term amount or a long-term, we're able to provide those services at the school and then follow up with, parents and other teachers and counselors as well. Evidence-based practices are listed there as well that we use with our youth: cognitive behavioral therapies, motivational interviewing, trauma-focused cognitive behavioral, etc. The 10 most common primary diagnoses are listed there for you, but the top 3, which we see, are generalized anxiety disorder, major depressive disorder, and post-traumatic stress disorder in our adults. And then for the youth, we see conduct disorders, generalized anxiety, and oppositional defiant disorders. Those are the top 3 that we typically treat. I do want to add, just outside of the report, that we do have a 16-bed inpatient unit, as you all know, for adults at our main center. We did provide approximately $4.6 million of expense operating that inpatient unit. We also provided a little over $2 million charity care, is what we call it. It's services that we provide that we just simply don't get reimbursed for, but we know that there's a need to do that with the population that we serve. We staff 361 Vigo County residents in our Vigo County location.
How many was that?
361. Again, I thank you for allowing us to give you the annual report, of course, and if you have any questions, I'm here to answer those. And I do want to also thank you for the Vigo County Group Homes for Children, too, because we partner with them. We have partnered with them for many years, and we are more than willing to continue to partner with them for any treatment needs that they have.
A couple questions. Do you know who our appointment is to your board?
It was, oh my gosh, I can't remember his, Kumaro, yes. I think it was Mr. Kumaro, but that one time it was, oh my gosh.
Yeah, we don't know either.
Right now it's Kumaro, Andres Kumaro.
So House Enrolled Act 1454 is a community mental health center not administered by a hospital licensed under Indiana Code 16-21-2 shall include a member of a county fiscal body or a member of a board of county commissioners or designee.
Yes.
And that's decided by the county commissioners, and we don't know who that appointment is.
You don't?
No.
Okay, maybe we should
And
find
I think
out.
the appointment that we would like
think
to
it's
have on your
Andre.
board is a county commissioner
Okay.
and not a designee.
Okay.
So just want to make everybody aware that passed legislatively last year and was signed into law in July to require a commissioner. So we'd
Yeah.
like to have that conversation.
Yeah, I think Terry is correct that it's Andre, but we can definitely go back and, how would you like to move forward with that?
I think we'll probably send an email from Terry
Okay.
or have Terry reach out to you guys.
Now, my recollection was, and Chris had asked me about it, was I think when Brendan Kearns was commissioner, that I think he was involved in getting Mr. Kumar appointed to the board. So
And that would have been 4 years ago.
I don't think anybody's ever reappointed or changed that appointment today.
Okay. All right.
That's the only.
Do you remember,
thing-
Chris, does the Hamilton Center share in any revenues from the casino, from mental health,
I don't think so.
gambling treatment?
No.
No, we do not.
You don't get any? Okay. Thank you.
Great, any other questions?
What kind of wait time is there to get into, if we have a person with mental health problem that comes off the street from the sheriff brings him in or whatever, what kind of wait time are they do you have?
We have a walk-in status, so it's immediate. We do a triage form, a triage questioning, so if they're in an immediate crisis, we see them right then and there. We have a crisis diversion center that's open 24/7, that's able to see people immediately in a crisis. If it is just an ongoing need or just an appointment needed, typically we can get them in 2 weeks. However, we also have walk-in with just, routine basis as well. So people can typically be seen same day. If they prefer to be scheduled, we will do that.
Anybody else have any other questions? Thank you very much.
All right, thank you.
Thank you.
Okay, at this time, any comments from the public? Seeing none, any comments from commissioners or other elected officials?
Negative.
Well,
I'm good.
you're good. Well, we did snow removal. I think I'd like to give our highway department a pat on the back, pre-treated, get the roads cleared, and kept after. Mother Nature let up on us a little bit a couple of days, and I think they did a good job for the people of Eagle County.
Much so. Okay, we'll stand in recess. See you next week.